right, so I'm going to get started here. I have already asked Casey for, are you guys able to see me relatively well here? Anybody jump in?
All good.
Okay, thank you, thank you.
Yeah, sure.
Okay, so I've already
Yes.
asked for consent. I've already cleared her for contras and precautions. I've already done a pre-assessment. I've checked her skin. I did cervical range of motion and lumbar range of motion. I palpated to find the spots that she's a little sore in. I'm going to hand sanitize here. And you see I've already got her draped. I do have a pillow under her hips. Her head is on the face plate. She doesn't like it in there, so she's got it turned away. And then I also have a pillow under her feet here, just for comfort. Okay, I've got her covered. It's nice and cold in here. So I'm going to use some lotion here. Get it warmed up, and I'm going to expose the area that I'm going to be working on here. Now she was already downstairs sleeping because she works nights. But she does not have a bra on. If she did, I would either move it up if it was a sports bra, tuck it in, or ask the patient if I could unhook it, okay? And just leave it laying, okay? It's really up to you and up to the patient, whatever is most comfortable for you. I'm gonna tuck the sheet here in so I can keep the lotion off of her shorts, just tuck it. And then I also have my trusty towel here, and I'm gonna come up and kind of tuck it in up top here, make sure I'm keeping her covered as much as I need to. I'm only going to expose. So I'm going to be focusing on kind of her mid-thoracic down to the lower back. She actually has had some pain in her thoracic spine. So after this, what I would do is some posture exercises, do some thoracic extension, maybe some Supermans, maybe some eyes wise tees, maybe get her on a foam roll and have her try to roll on the foam roll to mobilize her own spine. So my hands are a little cold here, Casey, I'm sorry. Get my lotion warmed up, and I'm just going to come on, and I'm just going to, do a little stroking here, okay? And you'll see this is very superficial, right? Okay, very superficial. I can come on and do one side. I can do the other side. I can come across this way, okay? I can do any of these. It's really just what area I need to target. Now, if I'm just targeting low back, I may not even have the shirt up this way, and I may have this down a little lower to expose sacrum, okay? But her area that I'm focusing on is more thoracic and upper lumbar here, okay? So here we go, okay? Now, you guys might say, well, if I'm going to do effleurage, which direction might I go in, okay? It doesn't matter a lot. I do have a pillow under her here. But in general, what I'm going to do is I'm going to come kind of up towards the head here just because of the area that I'm focusing on, and kind of pause a little bit and come back down. Okay, I'm using two hands. So I'm pushing up kind of towards the axillary areas here now. You know, we don't see a lot of swelling in the back. So what else might I be using effleurage for? Well, I'm just getting some of the interstitial fluid moving, right? If she's got muscle spasm, if she's got any trigger points, if she's got, areas of inflammation, maybe she has a strain, okay, and it's just been sitting. So I'm really just going to move it, okay, and pause there, okay? So I'm moving it. Can you guys see my hands okay? There we go. So I'm really using my whole palm. Kind of pause, and then I loop back around because I don't want to pick up my hands. Okay. Now, could I go in the other direction? Sure. Okay. Especially if I'm not worried about moving, swelling or edema. It really doesn't matter which direction I push it in. If I was going to come up in this area, I could come here and use my hands going in this direction, and then just kind of pause down here as well, and that would go into the mesentery area in the front of her body a little bit, coming down this way, okay? If I'm not moving edema, really the rules change a little bit. If I'm really working on just increasing blood flow and getting things moving a little bit, okay? Still gonna wanna try to get it towards the heart, or at least towards the lymphatic system if I can. Okay, so that's effleurage, okay? So now what I'm gonna do is I'm gonna do something called skin rolling. This is a technique that is in the book. It feels wonderful, okay? What I'm going to do is I'm going to take my thumbs, okay? You see my hands here. And I'm going to grab with my fingers, and I'm rolling down the spine, picking the skin up as I'm going. It's very nice for those patients that have poor tissue mobility, or if they have kind of those areas where maybe they have some muscle strain. I don't know if you guys can see that real well, but I'm pushing with my thumbs and pulling the skin towards my thumbs and just rolling on down. So basically, I'll come on this side. I usually use it, but I'm pushing and pulling with my hands like this, okay? And then I would just move. So you see the skin is like picking up. It's really rolling the skin, okay? All right. Then I'm going to come in and I'm going to get a little more lotion here. Try not to take my hands off the patient, but my lotion is halfway across the room, okay? And then what I'm going to do is I'm going to go in and start doing some palmar kneading, okay? So I'm really going to get in here. And I'm using my whole hand in a circular motion and just doing some palmar kneading all the way up and down, okay? I'm not going to go too far down, and I'm really getting into those spinal muscles here, right around the thoracic spine with my thumb. So a little thumb pad kneading here, okay? I could do one side or both sides, so I could come on here and just do some ringing if I wanted to on one side, okay? I could do some picking up if I thought I had, needed to. Just reach, and not everything is like a longitudinal long muscle, so I can come in and do each side separately. And then if I find a little, say, knot or something like that, this is your first kind of trigger point, but it's also considered friction massage. So what you'll see is my fingers are in like a tripod, okay, 3 fingers together. She's got some knots in here. I can kind of feel them. I'm going to go in, and usually I'm going to rub some of the lotion off. With friction massage, we don't use a ton of lotion unless it's embedded in another technique. So I'm going to come in, I'm going to find that trigger point, and I'm going to do 3 or 4 deep circles here and try to really target that little knot right there. You feel that? And then come out, okay? Then I'll try to find it again. Circular deep friction massage, okay? This is a way that we can work on those little tiny areas and then come out. So with each circle, I'm going a little deeper, okay? A little deeper. It's not a big spot. This would be considered a focal technique, right? So I was doing local, and now this would be focal. So I find a little trigger point, 1, 2, 3, 4, each one a little deeper, come out. And I'm probably going to do this for a couple minutes, okay? It's kind of like trying to chase it down and smash it. Okay, all right, and then once I do that for a couple minutes and really work on that one area, I'm going to come in and probably do a little effleurage again, okay? And it doesn't really matter. I just want to move the waist out, okay, as much as I can, all right? And then what I would do is go ahead and finish up with some stroking, okay? So that was a combination of all my techniques. Okay, and a little glimpse into some deep friction, okay? And I probably would do this just for a minute or 2 here. And once again, this would be, just kind of keeping the blood flow going, little gate theory. Hopefully I didn't dig anything up or make her any more pain. Her pain level go up, but I'm asking her the whole time. I don't know if you heard me, I was asking her if it felt okay. She's going to have a little redness in the area, both from me pushing, okay? And she's going to have a little redness just from the, the superficial dilation of capillaries. But you shouldn't see bruising, guys, okay? So if you're seeing bruising, you're going way too hard and too deep, okay? So back off a little bit, okay? That is the back. Okay, so now what I'm going to do is I'm going to stop and start my video again here. Hold on one second. I'm just going to stop it.